Good morning, everybody. My name is Cody Brown, and today's presentation is going to be on the United States healthcare system versus Poland. And as you can see, this is my introductory slide. So if you will please go ahead and click the next button. This slide is my intro and overview. I'm going to be comparing and contrasting, obviously, the two countries of the United States and Poland and their healthcare systems. But what is the purpose of this? I feel that the purpose of comparing and contrasting both countries, and no matter what country you choose, is important because of the fact that maybe we can shed some light on a way that our country can succeed a little bit better in making economic decisions and good policies and regulations for our future, as well as any other country that decides to do so. We're going to have some major economic debates, and it's going to be over the following categories, from history to workforce, public health services, technology impact, ethical standpoints, and government role. My last slide will go ahead and be my conclusion, and then I'll have my references after that. Go ahead and click the next slide for me. So the history. The tradition in the medical field is based around the idea to do no harm to the patients healthcare individuals oversee, and that's from Wells in 2018. So comparing both of these countries and any country we choose, we can always compare the fact that in medical, we want to do no harm to our patients. Obviously, there's going to be exceptions in their world, and we'll kind of see some of those a little bit later when it comes to ethical standpoints. Poland started out, obviously being a communist country, and it wasn't until 1989 that the country became part of the the European Parliament, and kind of broke off and started becoming a little bit more of a democracy. In 1997, the country ended up forming its own constitution, and it guarantees all citizens the rights of equal access to health services financed from the public sources that form from health insurance contributions, as well as from state and territorial self-government budget. Pretty much what that's saying is they do have obviously a free healthcare system, and it just kind of guarantees that all citizens have the equal right to that. And this is kind of where Poland and the United States are a little bit different, because obviously we don't have that type of system, and we'll again dive into that a little bit later when it comes into the government role. But we always have to keep this in mind that they do have a free healthcare system. Where is the United States? Where have we gone? Where have we come from, and where are we going? We instead of Poland kind of making a drastic switch, within the last 20, 30 years, since 1700, we've been making gradual, advancements within the healthcare industry and with healthcare systems, from having apprenticeships to training and all the way up to having policies like Medicare and Medicaid. The importance for both of these countries and what you can kind of compare to is the fact that, they want what's best for their population, and they always are looking towards the future, which is always a good thing, obviously, when it comes to the population, because if you don't have people, you don't have a country. So let's go ahead and hit the next slide. That kind of rolls into healthcare workforce. It is a large responsibility with us in the medical field to take this responsibility to go ahead and make sure that, again, we are treating the patients as best as possible, so we do have that population in case something happens. And as we can see right now with COVID-19, some of these different countries, their policies and regulations are definitely affecting them in a large way. The utilization of holistic and allopathic approach is utilized in different countries around the world. Us in the United States, we utilize both of them. The holistic mind, body, soul, with medications, as where the allopathic is more of trying to use medications first and treat, surgical treatments and things of that nature to try to go ahead and, treat the patient. We also in the United States use a primary, secondary, and tertiary type of triage method, as where Poland, on the other hand, because they're so new at this, they use more of a basic triage method. And the reasoning being is because of the fact they are a free healthcare service country. And with that being said, they don't have the funds and they don't have the supplies to be able to triage every single patient, to be able to have that approach to healthcare like we do, where you can go in and get, seen at any time. And again, we'll dive into that a little bit more later. Go ahead and hit the next slide for me. So public health services. Public health services include dental, vaccines, mental health, pharmacies, and pharmaceuticals, lab testing. And of course, there is a problem afloat in no matter what country we look at, but especially when it comes to Poland and it comes to the United States. We can see in both countries that there has been a low take back to getting children vaccinated because of the fact of a false accusation about vaccines causing autism towards children. Even though that that's been disregarded and has been come out and said that that is a false report, people are still continuing to do so. And as I have here a quote, a cross-sectional survey was conducted in 2016 on 1,239 parents and legal guardians of preschool and school children in Poland to evaluate the hesitancy of giving their children mandatory vaccines. They are obviously hesitant to give that to them. And, they want to do what's best for their children. And the problem is they don't have much that they have to do to not get that. There's no real punishment, I should say, for that. Go ahead and hit the next slide for me. It's going to be public health care continued. Side effects. Okay, so let's look at the United States. If you don't get your children vaccinated, what's going to end up happening is the parent has to stay home with the children. They won't be able to go to school. That hurts the pocketbook of the American citizen to be able to pull in money to be able to provide for the family. In Poland, however, they just have to pay a fine, and the child can go to school. And so there is obviously lesser punishment. If the person has money in Poland to be able to pay a fine, which, mind you, the fine is 2,000 EU, which is the currency over there. So with that being said, if they have the money to provide for that, what's it to them, because of the fact that they can pay the fine and not have to worry about going to the doctors if they really think that there's going to be some type of side effect off the vaccine, which again, there is none. So let's go ahead and hit the next slide. Technology impact. Types of technology include procedures, drug software, telehealth, and health records. In my paper, I chose to kind of base everything more off of the health record industry because I feel like that's such as a big thing within the United States and other countries, because it definitely helps out a lot. Not only are we able to take records and electronically send them to provider, we don't have that paper record most of the time. I shouldn't say all the time, but most of the time we don't have that paper record anymore. Poland kind of uses the same system, but in a sense, they're kind of at a setback because they still don't have those funds. They still don't have the ability to be able to, send information from provider to provider. Not everywhere is well established like we are here in the United States. And not only that, back in 2017, we did have a ransomware attack, which affected 150 countries, and both the United States and Poland were part of that. And again, that kind of set Poland back a little bit more. We have the funds here in the United States to go ahead and help us get out of this mess. They, don't have as much as we do, so it kind of hurt them a little bit more than it did us. So comparing, obviously, the two of them, we both want what's best as far as keeping track of somebody's medical record. They happen to use more of a paper method, is where we sometimes use it. We use more of a electronic healthcare record, and they're trying to get on board to do that as best as possible. Let's go ahead and hit the next slide. Ethical standpoints. This is a huge topic. So ethics is, by many definitions, the mainly concerned with what's right and wrong in perceived society and individuals. And that's by Niles in 2019. This is segregated by population. So no matter what population you look at, everybody is going to have different morals and ethics that they believe is right. So the only thing that I could really compare here is, in the medical field, again, comparable. Do no harm to your patient. And that's what people are trying to do. Unfortunately, though, your do no harm and my do no harm are going to be two different things to the patients. And because Poland does not have the funds, we can contrast this because they have the ability, if you have the money there, to bribe doctors. And by bribing doctors, they can turn around and get treatment faster. I do have a friend who lives in Poland. His name is Jack Gores. He is a patient who needs spinal surgery. He gave me permission to talk about this. Unfortunately, though, he has to wait 4 years. He doesn't have the funds to be able to do it now. The hospital doesn't have the resources to be able to do it now. So, it just kind of sets that back a little bit for the patients over there. If you have the money, though, you can bribe the doctor and hopefully get on the waiting list, much sooner than later. The other thing is, too, when it came to ethical standpoints, we in the United States take abortion, and we've been debating this topic for many, many years. they seem to be on the point of saying that it is totally illegal. Most of the countries on board with it, that it is an illegal process. So they're actually in the process of already coming to a point to prohibiting abortion within Poland lines, so to speak. So that is obviously a difference between the two countries. So let's go ahead and take a look at the next slide, which is government role. So government role for Poland, we've already talked about this. Free healthcare, major downfall. Jack Gore's trying to go ahead and get his spinal surgery. He is now taking quality and quantity away for free healthcare because of the fact that he has to wait up to 4 years just to be able to get his surgery for his spine. As where if he was here in the United States, he could get it much sooner, regardless of whatever his funds are. Here in the United States, we utilize more of a fee-for-service, and the definition I have here is fee-for-service is a traditional payment method for the medical care in which provider bills each patient provided. And the reason why I put that in, and that's from Henderson 2015, is because that's more of a typical thing that we see here in the United States. Other things that we utilize as assignments, such as Medicare and Medicaid. We also utilize capitation and risk sharing. Question of consumers paying, the question comes down to, is the consumer paying too much in the United States for healthcare, or are they paying too little? And again, we have to look at this from the standpoint of, if we're paying too much, what is our quality of service, and how much is the quantity of service when it comes to that? If we're paying too little, again, we'll also have to look at the quantity and quality of service at that point too. So it's kind of a take and give when it comes to that. The main thing when it comes to the government, when it comes to the economic resources and things that we have of that nature, obviously with the United States being 1/3 of its economy being divided into the healthcare system, there is a lot of money to be made. And government officials comes in every couple of years, and they go ahead and they use that money to try to stimulate the economy even more and take that healthcare system and push it to the next limit. So obviously there are many things that we need to look into when it comes to the two different countries. Let's go ahead and hit the next slide. Next slide is my conclusion. So overall, I feel that there was little to compare to the two countries. There were little things here and there that we could compare. The main thing is growth. Each country is growing, whether it's growing at an exponential rate, a slow rate, each country is growing and pushing to the next limit. And the other thing is we also can compare the fact that each country needs its patients and its consumers to be educated. That way we can make better decisions, get better elected officials in here to hopefully do what we need to do. Unfortunately, though, as I was talking about in the beginning of this presentation, is there is an economical debate, and everybody's going to have a different opinion when it comes to what should we do for the healthcare system. So what I think is right and what you think is right, two totally different things. There's always going to be setbacks. And I think that comparing and utilizing comparing and contrasting, like we're doing with these presentations, actually opens up our minds a little bit and has us really look into, what can be a good idea for our country versus what can't. But we always have to keep in mind one thing. No matter what may be good to our country may not be good to Poland's or the UK's or whoever you decided to choose. And vice versa. Whatever is good for them, and they look at us, it may not be good for them because, everybody's different and each economy is different and we all have different walks of life. As long as we're moving forward and trying to do, I think, what's best for our people, they're doing the greatest good for the greatest number of people, because not everyone is going to be happy with what we choose. I think that's what ultimately is going to help us out in the long run. I want to say thank you. My next two slides that I have are both my references that I utilized for the presentation. I had several more references in my paper. I wanted to take the time to say thank you for going through my presentation and watching my video. If you have any questions, please feel free to email me. Again, my name is Cody Brown. Have a good day.